I believe that many veterinarians have had little training in pain recognition. They've also, unfortunately, had limited education in the identification of low-grade lameness and the recognition of musculoskeletal pain as a cause of poor performance. They've had little or no education about how best to assess ridden horses, and therefore they may struggle to recognise the presence of a problem. As a result of this, if a rider presents a horse to a veterinarian with a problem that they are experiencing during ridden exercise, there is frequently an assumption that this must be related to loading of the back, and therefore the back may be the primary problem. Then there is the widespread tendency to investigate horses which are not performing optimally by performing gastroscopy, with an ultimate diagnosis frequently of equine gastric ulcer syndrome, without really thinking what was the underlying stressor which resulted in the development of gastric ulcers. And in my experience, many of these horses have underlying musculoskeletal pain, and unless that is addressed, even if the horse is treated appropriately with omeprazole and management changes are made, such as turnout, social interaction, and adequate forage, the ulcers will tend to recur. We must address the primary problem. It is important to recognise that the absence of lameness in hand does not preclude lameness when ridden. So this clearly demonstrates that a horse can appear normal when evaluated moving in hand, but show obvious problems when assessed ridden. It is my belief that a large proportion of ridden horse performance problems are pain-induced, and I hope that I'm going to convince you of this.